Well, hi, and welcome to the premiere episode of season 9 of Finding Your Way Through Therapy. It'll be episode 108, but this is probably the most meaningful one for a personal reason, is that I have what we refer gently as mental men group that I've known for several years. I consider all four men different types of mentors that I've had in my life, and I'm so happy for them to call me colleagues now, which is still weird to me, but I'll definitely touch on that, I'm sure, during our conversation. But I want to introduce Dennis Sweeney, who is someone who mentored me when I was doing my internship, and then went to work, and he was at the same job I was, and he mentored me through that. So Dennis says I'm a colleague now. It's hard to believe. We got Dr. Robert Cherney, who is someone who I also met through my first job as a therapist, who again mentored me through a lot of stuff and showed me a lot more about being myself, and really, really was helpful. Andrew Kang, who I don't understand why you would go from being a lawyer to a therapist, but hey, maybe he'll explain that today to us. I don't understand, but that's just me. And our favorite, who has now been on a total of 6 episodes, who has been here on different situations, and always well received and always well downloaded. So, and that is Patrick Rice. So I don't need to introduce him too much. But guys, welcome to Finding Your Way Through Therapy.
Thanks.
Thanks for
Thanks
having
for
me.
having us.
Yeah. Mm.
You know, it's funny because I feel like I know all of you, yet I think my audience doesn't know all of you except Pat. But Pat will still do an intro in case they missed those few episodes. But how about we start off with I start off with Dennis, so let's go with Dennis Sweeney.
So I've been doing this business. I was thinking, Steve, that we've known each other for a few years was a nice euphemism there. It's been more than a few. So I've been doing this since last century, and it's been a journey. I am a licensed mental health counselor, and my primary focus is on treating people in recovery. And I see recovery as a major part of the therapeutic process, regardless of what it is that you're trying to recover from. It's taken the shape largely in addiction and recovery. And I have, over the years, had a lot of struggle, but also found a lot of hope in watching people achieve recovery through a lot of effort. So that's
And
me.
we all know recovery of substances is also related to mental health. So it's always a great combo to think about. I'm not going to go with doctor. So Bob, you go next.
Thanks. Yeah, I appreciate that. Steve, I'm really glad you're having us on. It's really nice to be here with all these guys that I know so well. And knowing you, Steve, kind of seeing you grow over the years. I just remember I heard your name first when you were doing, I call it forensic work, but it's really, you were doing the court work and you were doing the stuff over at Advocates. And it was kind of interesting to see your growth, not only in the clinics, but then in your own practice. So congratulations. As per Dennis, I've been licensed 38 years now, and I'm a licensed psychologist. I'm also a licensed alcohol and drug counselor, and my focus is adults and couples. I've seen a lot of people that are, for example, in recovery, but I also have seen, people with different kinds of psychiatric illnesses. My practice, it's I think a little bit more narrow than when I'm at the clinics. I do community mental health work, and anyone who has done that, and Dennis and Steve, I know you've done it. You know that you see everything coming in the door. I am so grateful to have had the chance to do that. Now it's been 22 years this month. So, I supervise and I train people and I consult, but it's beautiful because the people that we are helping really need the help. So I love that work. And I'm just grateful that I've been able to do this for so long. And I plan on doing it as long as my brain will, hold out, and we'll see that, so.
Well, Bob, thanks for the compliments, and I will pay for the next round of golf. No problem. Thank you for the compliments. But how about we turn to Andy? And again, sorry, I don't use the
Hey.
formal names. Sorry.
No problem. As Steve, as you mentioned, I was a lawyer in a former life, and I had a crash and burn in that career and in my personal life around that time, and that's what led me to search for something with more meaning. That's how I ended up here doing this work. That's how I first met. I think Dennis was probably the first amongst you that I met. Like many of us on this call, but many of us in this world, we all got mentored by Dennis, and he showed us the ropes in a very, very major way. And that's how I met all you guys. But also running through the same place that Bob helms advocates, the community mental health organization that helped so many. That's where I did my training. That's where I cut my teeth and met all you guys. I think, Steve, you and we passed by in the halls when you were doing that forensic work there. And I remember thinking, wow, I think that guy's a cop. I better stay away from that guy. I better not mess with him. He looks pretty serious. But yeah, so and then I remember getting invited to Bertucci's one Sunday, where we all would meet and have a meal and just talk about all of the challenges of doing this work. And that's when they would open up the taps and I would just put my bucket underneath there and take in all that great wisdom. So that's what I'm looking forward to here too today.
Well, since you said I was so serious, I'm not paying for your golf game, but but I appreciate that. I didn't know that impression was odd, but I don't mind it at all whatsoever. And let's go back to Pat. Pat, you introduced yourself many times, so please do it again.
Okay, I will in a different way. And thanks again for putting this together. It's a similar lineage here. As other people that have seen my other cast know that I'm a recovering person. And when I was in rehab in the mid 80s, a counselor asked me, said, it looks like you still have a brain left. I said, what do you want to do with it? And I looked at him and I said, I want your job. And he told me what I had to do to get it. And I literally did that. I got to connect with him 7 years later, and he was not surprised. But that led me to meeting Dennis initially, because he was my intern supervisor when I was in graduate school. He's younger than I, but I am probably the senior citizen here. But it's Dennis really led me in a remarkable path. I'm going to give a little bit more about that, because in recovery, since this is about therapy and all of that, the process. In one of the first groups that I sat in, and one of the first of many therapeutic blunders that were the greatest learning experiences. In the processing with him afterwards, he said, it's time for you to do your work. That got in the way in there. And I said, what work? And he said, the work on your deep narcissistic injury, whatever it is. And I never forgot that. And that led me to a period of about the better part of a dozen years of remarkable psychotherapy that with a person that was very gifted in treating trauma and everything, which then became what I treated in dual diagnosis. And I've morphed from that. I actually then had graduate students for 20 years myself, just like Dennis did, in the same hospital that Dennis in that system. And then Bob and Dennis, who were the director and assistant director of an outpatient program as it evolved, gave me my first inpatient job as an outpatient clinician in the famous Start Out program. And so I've known them literally all my career. Wow, it's really true. Which spans, I've been licensed for 30 some odd years as well. So it's, but I everything that I am now, I owe to listening to people talk about the mistakes that we make and learning from them rapidly, and the fact that our patients are our greatest teachers if we listen astutely, and which has led me to a lot of things. I don't do the direct addiction work now. I work with families. I've done a lot of grief work because of the losses in the addiction process. You know, so many young people have died, and I do forensic work, as Steve does, and I know Andy does, and evaluations. But in my own private practice, which is still flourishing on Zoom now. One of the great things, the different great changes is that I haven't seen a person live in several years. So I'm very comfortable in this format now, and which I find striking in one respect, because I was very resistant. And I help people now with their own spiritual evolution, which I could elaborate a little bit about and what, for lack of a better term, is just ascension consciousness, or developing a higher state of mind. And one thing I've learned, and I'll end with this, is that as my brain ages and there's atrophy and entropy and everything physical, the mind and consciousness expand. You can still expand it if you practice that type of process, which is meditation and these types of things, which I now mentor a lot to with. And it's I think the natural adjunct is to healing people for what? For life, yes, and then to evolve. So, and again, part of this is I'm really eager to hear what my colleagues have to say as well, because that's why the Mental Men started, 25 years ago, and you know, it's still going. A form of it is going with more younger people in it, and it's probably been one of the most helpful things, not only for my clinical practice, but especially for me as a practicing clinician, to keep me level and understand that I'm not alone in this. We always have resources. And I've told every one of my grad students, you get a group of people that know what they're doing, and you stick close to them, and you'll never be without someone to ask, can you help me with this? Can I run something by you? And that's the greatest asset, I think, in my practice. Is I can see many of them right in this room. So,
and I think that brings up a little bit of you know, one of the things that I really appreciate from this group, and something that you guys really impressed on me, and I continue to do so to this day, is to mentor others. And I think that what I hear here is that, you know, Dennis, is the commonality here about mentoring. But I know Andy, and I know Bob, and I know Pat, and I certainly have also, but we've all passed on that ability to mentor other people. And I think that that's key to the development of this field. I think that learning from a book is one thing. Mentorship is a whole different ball game. And if you don't have a good mentor, and I consider all four of you mentors, so, and I have many others, but this has been, I think, the greatest gift I've got in my practice for all these years.
You know, it's interesting you say that, Steve, because you know, as Pat mentioned, we learn from everybody we see, you know, clients and students. I've been lucky enough to have interns from various college graduate programs around New England for the last 20 something years now. And I've learned a lot just from being, you know, the supervisor of these folks and trying to mentor when I can. And I'm always struck with, you know, if I can stay humble and curious and keep my mind open, it just keeps on, you know. Andy, it was a great image there with, you know, the spigot and pouring it in. That's how it feels sometimes, you know. And one of the things that strikes me is that the more I learn, the more I realize I don't know. And I keep on, you know, I love it. And I sometimes I wonder how people get into this, but then I've kind of come to the conclusion after many years of my own therapy that I think a lot of us get into it because we have lived experience and we search for answers. And if we're fortunate, we do our work and then we get into the field. And I come to the conclusion that if you are just looking for answers, you may not stay in the field, or you'll stay in it in a way that isn't directly clinical or directly working with clients. You can do something else. But if you stay in this field and you continue to do the clinical work, you have to have the heart and soul for that. And that's the soul kind of develops over time, fortunately. And Pat, stuff with the meditation. And I mean, I've had a meditation practice now for about 20 years. And it's fascinating to see how you can grow, but it's also a good thing to know your own limits. And I think that's where, as we age, we have to, you start to feel some of that stuff.
You know what I've really, go ahead, Andy. I'm sorry.
Oh, no, I just wanted to add to that point that Bob was making, that a lot of times I find that it's the asking of the question that's much more important than the finding of the answer. And that, the clients certainly are directed towards answers, but they're not really, what we're doing with them is learning, teaching them how to search, teaching them how to ask the question and then figure out what would be part of an answer without ever actually maybe even getting there, and being okay with that and the discomfort of not knowing everything. When I'm doing supervision with clinicians, that's what I'm trying to impress upon them. You need to get the people to ask the questions and to be searching for themselves, as opposed to chipping in with what you think the answer is. I have that problem myself, so I have to pull back on my own reins so that I'm not jumping the gun in that way.
And I know that one of the things that I've really got impressed by, kind of like doing that transition, one of my first professors in undergrad had said, this was McGill University. There's about 1,000 people in the auditorium. I am not kidding you. And the professor says, how many are here just to learn about themselves? And a bunch of hands went up. I said, okay, of all those who have their hands up, how many of you are actually doing therapy? And a lot of hands went down. I said, all the hands that went down, you'll probably be lousy therapists because you're going to just look for answers through others. And I always remember that because I was like, at first in my head, I went, fuck you. And then after that, I'm like, no, he's right. Which I guess brings up the next question that I have for every guest that I have. And now I have 4. And let's again go back with Dennis. And the question is have you ever been in therapy yourself?
Yes. It was a long time ago, and I remember very clearly I was feeling stuck, and I needed to understand what was keeping me from being able to do the things that I needed to do. And I have to say that there were 2 primary experiences in therapy that were obviously I still carry them with me because they are so close to my awareness. And one was I came to understand at the time that part of what was happening is that my wife and I were pregnant, joined there a little bit, that my wife and I were pregnant with our first son. And I was having one heck of a time finishing the nursery. And my therapist said, well, that's what your dad would have helped you with. And it just was a remarkable point of realization and a flood of tears that I just did not know was there. So there's just so much that we can help people to understand about what's painful that you might not really be aware of. The other one was that he said to me very clearly, he said that I needed to stop being so damn serious about myself.
Who are you?
So I'm still working on that one.
Well, Andy told me already that I'm too serious, apparently, so I got to be careful with that too myself.
That was my erroneous impression as a young social worker, Steve.
Yeah, if you listen to the podcast and you've known
He
me
was
now,
also a lawyer. Remember that too.
well,
Oh,
Dennis, thank you for sharing that. That's
Mm.
an amazing realization. We all have those aha moments in therapy that just kind of gets
Mm.
us, and it just means so much. I know for me, that meant a lot. My therapist to this
Mm.
day still makes me go aha a lot, which brings me to different points of view for sure.
Yeah, I'd like to add, I just wanted to add one thing regarding Dennis. You don't know this, but you were an inspiration for me to get back into therapy. When we were, running the program over at HRI, Dennis and I worked together for, it seems like it was 30 years, but it was, it was a long, long, long time. And I loved that. And then you left, you left understandably so, because, the commute all by itself was bad enough, but there are other things too. And losing you, it triggered some grief in me that I hadn't really, worked through around my mother, who died very early. And so it was really interesting to kind of do that work even after I had done other therapy work, and that helped tremendously. But I just wanted to, thank you for that. It was something I didn't really know was still laying within me. So
Yeah, the therapy may conclude, but it never comes to an end.
Ooh, there's a bumper sticker. That's beautiful.
I need to remember that for the little soundbite I'm going to record for this episode.
I still quote him all of the time. I hear myself channeling Dennis now. I still do. Yeah.
Well, we all channel Dennis when the moment gets serious, and I think now I channel my inner Dennis, and I go and get people when it needs to be serious. So Bob, you enjoyed your experience in therapy?
Oh yes, I started probably around 27 when I had moved out here for my internship. They had a program back then. That's just kind of one of the things that's changed for basically residents, psychiatric residents, and psychology interns. And they would literally do an evaluation over at Beth Israel, and then basically pair you with a therapist that they felt was going to be good for you and with you. So I participated in that, and I was fortunate enough to find my first therapist, and it lasted for years. And I really feel lucky. I'm probably about the age he was then, and there's so many little tidbits that he was able to show me, not only about my experience or how it's impacted me and my family of origin, which is always an interesting topic, especially my family, but also little tidbits around like the therapeutic relationship, the therapeutic alliance. He said to me once, if you can help a client feel safe, respected, and understood, that lays the foundation for a lot of the work. And I've never forgotten that. It's funny what stays with you, but I've always been grateful though, and I had very good experiences in therapy, and I've encouraged members of my family to do that too. But one of the things that strikes me is you have to make yourself vulnerable in order to do the work. And if that's something that you're afraid of, or you don't think you can handle it, if you really do get honest with yourself, I can see why some people will either not approach therapy or they'll drop out prematurely.
I think that what we learn in therapy is also what we learn about ourselves. And I don't know if you guys, we'll get back to a little bit of the therapy, but I certainly sometimes ask questions. I'm like, maybe I should ask myself that question once in a while too. And I don't know if that happens to you guys, but it certainly happens to me fairly regularly.
I agree. I do therapy constantly on myself, which I got a few rough edges. So, and I part of the way I describe it is I the sandpapering off the rough edges, and really listening to feedback from others, in both overt and subtle ways, and it's endless, and it just continues, Dennis, as you mentioned it. I really don't think it's ever going to end, and I feel that's a gift.
Bob, my my arm's getting really tired from sanding all my rough edges. I gotta say,
Yeah.
my shoulder and my arm starting to hurt.
I got.
Well, we need to hear more about your sanding then.
Right. Exactly.
I've
Yeah.
been in therapy, since early 2000s probably, and I continue to be in therapy. When I supervise people, I say you need to be in therapy and you need to be in supervision. So I do both those things. I do private supervision. I do the group, not as frequently as I should, and then I do therapy, and it is my weekly honesty break. It's my weekly check-in, Bob, like you were saying about getting vulnerable. We're in this position of what is essentially power all week, and we're the authority in this position a lot of times, and so it's good to be in the other chair. It's good to be the person who just gets to unload or say the crazy thing because you need to say it. It's another thing to be receiving that all the time, but I just find it's completely necessary to keep my head on straight.
I couldn't have said it better myself. I think that you talk about the work being forever. I sometimes need someone to work my rough edges, so I'm still in therapy regularly, and my therapist reminds me of those rough edges. I don't sand as much; it's more like an axe, but nonetheless, I still do it. How about you, Pat? I know we've talked about it before, but let's throw it.
Well, my last therapist, when we terminated, gave me a power sander. So it's because I needed a shoulder then. So it's I was in therapy before I got clean and sober in the mid 80s. I would say it was ineffective at best. But one therapist, when I did go into treatment, I called her from treatment and she said, "Oh, that's what it is." I knew there was something. She fired me, actually. She told me I was wasting her time and my money because we're going around in circles. She couldn't figure out what, I was gaming myself and her. So that was very useful. I never forgot that. But I was in therapy from about 1986 until probably the early 2000s, well into, probably, so I don't know, the better part of 20 years with the same person, mercifully, who I started out when she was a mid-age intern and in what was then Trinity Mental Health back in the day. We all remember that. And it's, and then she went into private practice and took me in. I say this moved is that I told her I couldn't afford her. And she said, "You can't afford not to see me." So she treated me pro bono until I could afford her, which I returned that. I paid that forward a lot. And, but it still gets me. Not that gesture, which was humanitarian to say the least, but how much what was to ensue, how it helped me, how it defined me, and how it allowed me to do this. And the last probably 5 or 6 years was more like practice management. She was teaching me how to be a private practitioner as I was trending out of the structure of institutional work and all of that, and really developing the full private practice. So that whole process led me to and what Dennis had invited me to look at in my own, when I was his student, is that every student I had, but actually the bulk of my students were when I was doing forensic work, and I trained them to be emergency room clinicians doing psych triage. And so I sat there and I would triage them first in the interview, and if I took them on, then I'd do it even deeper, and then I would suggest. Actually, it wasn't suggestion. I'd say, "Okay, you're here on Tuesdays and Wednesdays, and you're going to be in therapy for an hour on Wednesday with this person. Okay, they take your insurance, blah blah blah." And I said, "No, you don't understand. This will help you, but also you're going to get the privilege, which I had, of watching a really good therapist work. You will steal things. You're going to know how to do the work. and it will be intuitive, and you'll also heal so that you don't make as many mistakes as you can if you don't do your own work. So it's that classic, which I was taught, is that, you don't put the bumper sticker on that says, take my advice, I'm not using it. And that's what I've heard here, is everybody's authentic in what we do. And I was not only gifted by Dennis and Bob as mentors, but someone that they knew. I'm not sure Andy knew, but an AA sponsor mentor that I have for many years, Dick Fleck, who we all work with, and he was someone that was invaluable in my life, teaching me how to be a man, just how to grow up and behave like an adult and not overreact. And I think he was the one that said, he was a chaplain as well, but he said, and a Dominican, but he said that if, when all hell's breaking loose around you, especially in an emergency room, the calmer you are, the more curative you can be. Everybody, your fellow clinicians, everybody needs you to be the calmest person in the room if you're going to be helpful. I never forgot that. And then another mentor that we all had, Arthur Sermacoli. I remember him once saying something similar, but he said, the difference between a smart therapist and a wise therapist is a smart therapist knows what to say and a wise therapist knows when not to say it. I've never forgotten that. And but all of my students, and many of them will hear these podcasts because they really like them, and it's reconnected me really great to a lot of them, which is a nice piece of the puzzle at this point in my life, was just reconnecting to people that were so important in my life. But it's allowed me to really see how much this is a fluid process, a dynamic process of paying it forward. And we're always connected to those that helped us, and we learn from those. I learned so much from my students because they all brought from all over the country. There's students from many schools from all over the country that just, their own experience enriched me and the diversity in my practice. So, and I think more than anything, it has been the ability, I'll just say with my therapy, and then I'll end, is that I went from basically kind of cognitive behavioral therapy as my therapist evolved, and she was a Janine Roth and EFS and then EMDR therapist. And of all of the things that helped me with the core work that I needed to do, it was EMDR. It was stunning. I know, Steve, you're a skilled practitioner.
Bob also.
It changed everything. And then I was referring people out. So I saw the multimodal additional idea where you can consult with other people. And I encourage a lot of my patients to do that, to use all of the available treatment to effectively, comprehensively, it's like functional medicine now, comprehensively treat it. And now with the magnetic therapy that is going on and all of that, they're starting to understand brain and what's actually going on. So the next generation is going to treat illness, not symptoms. And they'll actually figure out all of these medications, what they're actually doing in the brain, and not just treating the symptoms. Because when you do that, you chase the symptoms, the side effects with more medication, and then you're chasing your tail. So sorry, I ran on there a bit, but I couldn't be where I am today, personally, professionally, or spiritually, if it wasn't for all the help along the way.
I think you bring up a lot of good points here. And one of the things that, when people ask me what the most effective therapy is I say it's the therapeutic alliance. It's not a particular type. Sure, CBT's proven to be a little better for mood disorders than others, but ultimately, if you don't have a good relationship with your therapist, it doesn't really matter, does it? Mm-hmm. I think that you mentioned another thing about the brain work, and I can talk about neurology all the time and EMDR. And I think EMDR is a kickback to old school psychoanalytic therapy. And people talk about it as a thing that's not like that. But to me, it's like we are blank slates when we do EMDR. I'm not intervening as much as I usually do. And it really is leaving that space for people. So I think that everything, like you said before, Pat, I think is there's only 3 original ideas in the world. We just recycle them. And I think of EMDR as a recycling of a little more active, but nonetheless much more psychoanalytic than people give credit for EMDR. And that's just my 2 cents. There's two places I would like to go here, and you guys can decide what you want to go. But the first thing is about mentorship. And I think that that's something that you all mentioned, and I certainly mentioned it right off the top. But I know I wouldn't be where I am if it wasn't for people like Beth Ann Schacht, all you guys.
Yeah.
For me, even, I've had Greg Wildman, who taught me a lot on the crisis team. There's Sarah Cloud, who really has helped me in different ways. And I look at my colleagues in my practice today, and they learn from Megan, who's going to be on the podcast, Courtney, who has been on the podcast, Kara has been on the podcast, Bill has been on the podcast, Michelle has been, like, we can get us information from everyone else. How important is it for a therapist to go through some sort of, like, I don't know everything, because I think that when I was 20, I knew everything. And as I get older, I really don't know anything. And that mentorship is always such a valuable tool. So I don't know if you guys want to talk a little bit about mentorship, but I think it's a good place to go here. Anybody who wants to go in and jump in except Pat.
Fair enough.
I'd be interested in hearing Dennis's perspective on this, because I think in certain ways, Dennis, you've mentored all of us, including me, and you have a wisdom about you, and that seriousness. I tell you, you're the guy who used to ask the questions that I couldn't answer, even when you and I were running the place. So.
Well, what I was thinking back to was the very first job. My oldest son, and I guess I am plugging something here, Steve, a little bit early, but my oldest son has involved us in something called Storyworth. So we get questions. My wife and I get questions on a weekly basis that we respond with written answers to, and at the end of a year, they will put together a book of all of these answers. And one of the questions was, what was the most important job that you ever had? And sort of a lot of different reasons for a number of different really important jobs. And so one of the most important jobs for me was my very first position on the open psych unit at Leonard Morse. And it was one of those places where the theory was, we are going to bring in people that need to be trained. We're going to train them as best we can, and then they're hopefully going to leave and sort of take that training and good news elsewhere and spread it around. So that was the sort of the first place that I was exposed to the importance of mentorship. I remember as I left that job, one of the people that had one of the biggest impacts on me said, when you first came to the unit, it was clear you were a pretty nice guy, but you didn't know anything. And that was absolutely true. And it was through the people that were caring enough to sort of step beside me. I never had anybody really pushing. They were all stepping beside me to help me to learn. So mentorship, it's just incredibly important. And it also addresses what I think is one of the most significant aspects of therapy, is to help people to understand the negative impact of isolation. I spoke of recovery being sort of a primary focus for me. Isolation is a primary enemy to anybody's recovery. And so that mentorship also addresses that very directly.
And I think that it's not a plug, Dennis, as much as something that you really enjoyed and made a difference in your life. So no worries about that. And I'll make sure to actually try to figure out how to put it in the show notes so that people can go to it if they wish. Andy,
it sounds amazing. Yeah, cool.
I think that it's something that we should all be doing, because, except for, me, who's in my early 20s at this point, I think that we all need to start looking at our lives in a different way, and I think that that's really appreciative. I think that having to sit down and doing that is probably much more fun than it sounds.
Yeah.
Well, much like therapy, yes and no. There was a lot of therapy, a lot about therapy for me that was not fun. A lot of it was like pulling teeth. But it was still very productive, I think.
It's funny you say that, Dennis, because people come in and sessions are difficult, and they want to know, why aren't I feeling good at the end of this?
Yeah.
And usually what I say is, well, it's because you're not at the end, first of all, and there may not be an end, but it isn't about getting happy or even making the bad feelings or sad feelings go away. It's really just learning how to weather that stuff. I mean, we're talking about mentorship. One of the things that I've learned sitting with you guys is some of the stuff that you've talked about being calm, and what being patient is another one that I think of with you guys all the time, is waiting and letting stuff develop. As I said, I always have to pull back on my own reins because I'm wanting to jump in and jump into stuff. Whereas, I've learned from you guys and others that if you let it come to you, it's a lot more powerful much of the time. And another piece of mentoring that I try to do with my students and other people who I work with is just the concept of modeling. It shows up in our work all the time, every day with clients. We are, in large part, I think, modeling certain behaviors, modeling calmness perhaps too with clients. And that's what I'm doing as well, learning from you guys, is following your model, trying to find wisdom, which, boy, that's a challenge, because I feel a lot of times like I don't have it, but it's maybe not for me to decide even whether I've got it either, as long as I'm looking, as long as I'm kind of consistently searching for it. I think that's, for me, the important part anyway.
Interesting. Andy, I was going to just piggyback on that because I agree with you. The modeling that we are able to exhibit or display to our interns or whoever we're trying to enable and teach, I've noticed, especially within the clinic settings, how we treat other clinicians is often a very important thing. How do we basically communicate whether or not it's something that's really positive, noticing that, or if it's something that's negative, like, well, your productivity hasn't been very good for the last 2 months. I mean, there's so many little details now that we didn't have to deal with before, but I really think people watch and they say, oh, this is the culture. And if we're fortunate, I think we have a very supportive culture that people can, take risk in and learn from and can grow, versus something that they feel like the imposter syndrome, I call it. Usually when people come out of grad school, it's underneath it all, yeah, they might have a master's or even more than that, and they just feel like I shouldn't ask any questions because I'm supposed to know everything, and that's really one of the fallacies of the educational system. You learn a lot of what you need to know in this field on the job, but I love the fact that we can impact the next generation of therapists, and it's wonderful. And I agree with Pat 100%. I think the brain-based interventions, EMDR, transcranial magnetic stimulation, some of the stuff we're doing, this is the future. Although we will never get away from the therapeutic alliance and needing to have a very strong bond or relationship, however you want to conceptualize that, with our clients, so that they trust us, because that's a huge issue. And especially if you have a trauma, if you have somebody who's really experienced trauma and in the community mental health system, it's probably 85%
Mhm.
at least of our clients have experienced some form of trauma, and that's a whole nother topic to discuss.
Mhm.
I think that if we talked about trauma, we would be here for another hour easily, because I can't remember who had said this to me, but trauma is the gateway drug. And it is
Mhm.
absolutely the gateway drug to not only drugs, but also mental health issues. And a lot of the work that we do, frankly,
Mhm.
in my opinion. But I know, Pat, you wanted to say something about mentorship, because
It's
I just hear
thank
it in
you.
your voice.
Of all of the things I've done, I've said this before a lot. The favoriteest thing I ever did was I was 20 years of grad students. It was the greatest loss 10 years ago when I walked away from the hospital system and all of that. Is that one of the reasons I walked away is they were ending, the people that bought the hospital were ending the intern program, which I ran, and I was okay, I'm gone. But a couple of things I just wanted to hit upon. I'm not going to talk about trauma, but I'm going to talk about, it's kind of like I've worked a lot with head injuries as well, and TBIs, traumatic brain injury. There are soft versions. Substance abuse can create traumatic brain injury on top of the ones that are caused by other things. But I think the thing that hasn't been discussed, and it has affected me, both this, I'll start out when the pandemic hit and the social isolation of it. I say that I work in Zoom now all of the time exclusively. But there's a loneliness to this that I didn't have, even when at the collaborative in Natick, where Andy works now, and I work, when you always had people around you. It's like working in clinics. If you were having something that just happened with a client or whatever, you could always grab someone. You got a minute. And it didn't have to be another psychotherapist. It could have been the naturopath or the myofascial person or somebody. But you have another clinician that you could just say, you got a minute. And so I've really encouraged people that I continue to mentor to this whole idea of having a network of a collegial network, or your own supervision. When I recommended students for jobs, I said this universally. I said, okay, if you're going to hire this person, know that they have become incredibly used to and demanding of supervision. So if you can't supervise them adequately, at least an hour or more each week, don't hire them, because you won't be doing them a favor or yourself. And I said, and the other thing Bob alluded to it is that I said, from the students that I was able, virtually all of them, recommend, I said, what I'll tell you is the highest form of praise. They know what they don't know, but they're gonna be coming to you to find, so they won't make a mistake as readily as others may, because they really understand what they don't know. But I see this whole, I think we're just on the verge of starting to understand the soft injury to the soft trauma of COVID, what it did to the school systems and the social isolation. And it was like some form of a concussion grenade going off, and in a very slow process that I think that the next generation, and we're starting to see it, but the next generation, especially of educational psychologists, are going to really be finding patches for this. And how do we get these kids re-engaged? One last piece is that I'm someone who is, still, as I approach, 38 years sober, I still go to meetings. That's this huge network for me. I go to two men's AA meetings, intimate. One of them is very intimate. It has basically 8 or 9 people in it. But it is more a form of mutual self-help psychotherapy than it is a traditional 12-step model. And one is a very, very traditional model. And there are men in there from the class of 86 and 5 and whatever. I've never really been without a sponsor. And the person I use now is someone that is, my generation, if you will. And we basically sponsor each other. But we meet for 90 minutes every single week, at least, if we're not playing golf for 4 hours in the golf buggy. But we meet for 90 minutes every single week and just process life. And it's funny how that goes, is that type of an intimacy, is that some days he's working and I'm using, and some days I'm taking care of him in that regard. the good news is it's rare that both of us are troubled enough, so we always have someone to rely upon. I've never outgrown my need for that connection, thank God, because I totally agree that as I think it was Dennis that talked about the social isolation is that is the wormhole that truly is. So.
One thing I want to add also about the mentorship part, again, talk about all of you guys. And obviously, I feel like you mentored me in different ways. You know, I'll toot my own horn. When we did go through the pandemic, a lot of you contact me and say, Steve, how the hell do we do this?
Yeah, thank you.
Because at the end of the day, I've done this for over 8 years now, going on 9 years. And I could mentor you on how to do it and maybe the soft spots and all that. And when I think about mentorship, I always, when I was younger, and I joked that I was 20, but I'm not that young. As I get older, I realized that mentorship is something that continues throughout your life, and you can mentor the mentor sometimes too, and vice versa. I don't know if that's your experience so for you guys, but I think at one point you also share with everyone because that's how you learn. I don't know what you guys think, but
You mean sharing personal experiences, or?
well, I think of like when I'll go back to the EMDR comment, which is eye movement desensitization and reprocessing, just so that everyone knows what we're talking about. I remember when you started your class, Bob, you had called me and said, Steve, can you help me out? Can we talk about this? And I always saw you as my mentor. And then I could mentor you through the EMDR, which was to me a blessing. I appreciated that you trusted me so much. But I think that mentorship is not, I used to think about it's always the person that's older who's been around the longest, but sometimes mentorship can also go both ways. So I don't know if you guys disagree with me, agree with me, or what you think about that.
I don't think any skilled profession isn't a function of this, that I have not met a clinician I couldn't teach something to or learn something from. As you said, Bob, that the more we learn, the more we understand how little we know. The human condition, the earth school, if you will, is a really complicated school. I believe it's the hardest school. And you need a lot of help to get through it. It takes a community. I heard a statement once in a meditation program, more Hindu-based, but is that the recovery of your sense of well-being in yourself always requires a community of recovering peers. And that wasn't talking about addiction recovery. It was talking about the recovery of self. And I posted something this morning that I came across in my own meditation that was by Carl Jung that said, we spend half a lifetime developing our ego and then the second half of our lifetime letting it go, which it just hit me. Yeah. And he's the kind of the spiritual godfather of psychological godfather of 12-step recovery. So it's an ongoing process, but it takes a community to heal. And I have this privilege of looking at a great part of my community on the screen right now. And it's a really gratitude moment for me.
Well put, Pat. I was thinking about how everyone can teach us something. And I'm laughing because 10, 15 years ago, I lose track. I had an intern and he starts talking about this thing called narrative therapy. We didn't have that when I went through. And so one of the fascinating things about him, he's in a private practice now, but we were able to formulate treatments based on that theory, and as a result, I was able to learn it more than I would have if I had gone probably to some kind of a seminar. But it's fascinating. But you have to let your ego deflate, as they would say. And thank God. But some of the things that have evolved over the last 40 years, it's amazing what's been introduced. EMDR is another example, Steve. I mean, the whole idea of doing EMDR. I was trained in hypnosis way back when, and there's some similarities, but there's also quite a few differences. And I think that it's an extremely effective therapy for certain people. And, there's a whole lot just in that little piece, but I feel very lucky to have learned, because I was probably the oldest guy in the room when I got trained for EMDR. and it was fun, you know. But but the stuff I've seen, and Steve, you've seen more than me, because once we went virtual, you know, I felt like, well, I think doing EMDR via the Zoom may be a little uncomfortable because of the fact that if somebody's decompensating a little bit, I like to be in the room with them versus, you know, over the Zoom. But there's a whole, you know, as you well know, Steve, there's a whole group of things that you can do. There's whole websites about how to do virtual EMDR, which I think is pretty effective.
Dennis, I was looking at you chomping at the bit after Pat was speaking, so I want to hear what you have to say.
Well, I was thinking that, you know, I think, Steve, what you were referring to was that the idea of, you know, we can get information, and we can get technique, and we can get training from one another as sort of mutual mentors. I have to say that everybody else on this screen has been a significant piece of helping me to feel good enough, and as if I'm a competent person in this business, and that there's I can't thank people enough for that.
I couldn't agree more.
Mhm.
I rely on this group to stay sane.
Mhm.
You know, this is an isolating profession. We spend so much time in our head, even though we're sitting right across from another person, that you've got to let yourself out of there every once in a while. And it's not just at the end of the day you know, walk out of the elevator and all of a sudden you're fine after, you know, a whole day of clients. You need people who understand what that's like. You know, I imagine it's kind of like being a boxer or being a soldier or something, that, you know, it's such a unique experience to do what we do with other people, that only other people who do it can really kind of understand it. And you need as many of those people around you as you can get. So I feel like I'm always kind of searching for new mentors, and sometimes that means people who have done it less long than me, or who are teaching me something new, like narrative therapy. I just learned about that myself. Makes a lot of sense though, right? People tell stories, and that's the basis of it. It makes a lot of sense. I think a lot of the stuff, Steve, you were talking about psychodynamics and how EMDR comes from that. I started out in therapy and analysis. That's what I was told to go do. You need to go do analysis. And then I learned that it was going to be like 5 years. And I just thought, wow, okay, I guess I'm really messed up. I guess it's going to take me 5 years. And that was, you know, 25 years ago. So it was still underestimated. But I think we don't know where we're going to get help from, and we don't necessarily know who's going to say something or behave towards us in a way that makes us feel makes us feel good, or makes us feel better than we're feeling at that moment. That's what I take to our golf games, you guys. You know, I walk out there with my whole week kind of still on my back, and I feel like I leave it out there, and when we're done, I drive away lighter. So
Literally drive.
Yes, absolutely.
You know, I think about, and I don't know if you guys, I feel like I'm going to plug something, but this is really not a plug, is The Myth of Normal by Gabor Mate. And I don't know how many of you have read that or listened to it or what have you. But, you know, one of the chapters that he talks about is that we all go into professions to heal something from our past. And the first moment I listened to that, I was like, oh, crap, he read me like a book. And I'm like, wait a minute, it is a book. And I think that that's what I'm hearing from all of you. And it's being very conscious. I remember Dennis saying that to me, like, remember that you also bring yourself to the room. And what are you bringing in? I remember that conversation with you, Dennis, very vividly. We were doing group, this is a long time ago, at a partial at the Community Health Center of Advocates. And so I think that that's something else to keep in mind here. Just a thought.
Well, I do a lot of work now, and my practice is pretty much energy work, in which is another chapter in this. But it's what energy do you bring in, and how do you balance your energy? How do you retain your energy? How do you not take on somebody else's energy? It's the old model of knowing where you end and they begin. And you need mentorship to figure that out, because it changes. Everything changes. As you get older, I'm 75 now, as you get older, stamina becomes an issue. So you have to be much more protective of your economy of time and energy. And so we'll always have to stay on our toes. But I think a place for me to kind of end today is that when Bob was talking about this whole idea of growing, a long time ago, I read someplace that the only fountain of youth that really matters is keeping your body as strong as you are able to, and stay curious, keep learning, because that is the key. And if I have any concern, is that someday I'll just get bored. But I know that hanging around with folks like you and doing this type of work is the most interesting thing I've ever done. I'm pretty much a half a lifetime at it now. It's compelling. I've never lost my interest in it. I still like meeting new people. I like trying to solve the puzzle and help people and all of that. And if that isn't the most vital thing, it gives me vitality. It's significant at every level, especially the spiritual level. So again, thanks for setting this up. And as I'm looking behind you, at your book cover, Finding Your Way Through Therapy, this has literally been like this journey here is how do we find our way to continue to be able to be helpful to others. And I really value this connection to all of you as much as I do every round of golf. Golf is kind of adjunct to the whole process as I see it. So, but
golf is
thanks.
Never about golf. It's about being with other people. And thank you for keeping me on track on time, because again, we went through an hour. I think I said pre-interview that we had 1, 2, 3, 4, 5, 6, 7, 8 questions. I think we went through 2.5, maybe.
Part 2 coming up.
So, you guys are going to be invited again, unless you don't want to come, and it's fine. I respect that. But I think that there's a lot to be said in regards to different things that you both, everyone wanted to bring up. And so you're invited to come again for the next season. I like to separate our time to keep the suspense to everyone. So I really wanted to thank you guys. And it's been a great, this is exactly what I thought would happen, is we come up with like good questions and we never get to them because there's so much depth of knowledge in this group. I was calculating quickly that there's, over 100 years of experience just on this screen in this field. And we are also humbled knowing that with the 100+ years that we have, we still don't know everything. And I truly respect that from everyone.
Thanks, Steve.
Thanks, Steve.
Thanks,
I
Steve.
do really enjoy the sequel. I'll be looking forward to that.
Well, you're invited to the sequel.
Yeah. At the golf match yesterday, the guy said, "What's this going to be about?" I said, "It's like a play date, really. You're going to have fun."
Well, this being the summer, I'm looking forward to getting a few phone calls and joining you guys on Sundays. I want to thank everyone, and we'll definitely do a second part very soon.
Thank you, Pro.
Thanks for having us.
Yeah.
Yes.
Thanks, Steve.
Thanks.
Thanks, fellas.
Bye, guys.